Welcome to Doctors N. I'm gonna be your hostess for the show. My name is Lulia Houbi, and we have with us Dr. Hibah Shahta. She's the Managing Director and co-founder of Child Early Intervention Medical Center. Could you please tell us more about autism and more about yourself and about this amazing clinic?
Well, first of all, I would like to thank you for hosting this episode on autism, which is a very important developmental disorder affecting children in the first 3 years of life. Autism is on the rise. It has been there for so many years, but not increasingly so fast in the last 5 to 10 years. In 2008, when we established the center, we had one child diagnosed per every 150. And today, CDC are giving us the estimate to be 1 in 50 children. So it is a disorder that is affecting more children every year. Why I'm involved in autism? I'm a dentist, and my daughter was diagnosed with autism in 2007. And when I looked for services, it was really limited when it comes to child who's 1 year old or 1 year and a half. Most of the centers accept children after the age of 3. Early intervention is a key for success in children who are diagnosed and the signs are picked up very early, because with the comprehensive treatment, the children can have an opportunity to grow out of it. And this is why I am in this field and trying to raise awareness toward the importance of early detection, identification of children at risk at nurseries when they're very young, because the results of treatment become much more predictable. And there have been a study showing that it would save 70% on the government on a long-term health plans for individuals if they don't get the early intervention.
What's the relation, doctor, between the autism and the mental retardation and the hyperactive disorder and the learning difficulty?
You might find children who have autism and mental retardation, or a combination of hyperactivity and autism. It can happen at any time. There are other disorders also that we see associated with autism. The difference is, with autism, there's a classical signs. There's autism spectrum disorder, where the child can have very, very mild, and they call them high-functioning autism, and to severe cases. Sometimes they can have seizure disorders. A lot of time they have learning difficulties because of their limitations, and then they would be difficult to teach in a normal classroom with a normal classical approach to teaching. With hyperactivity, is a chronic disorder affecting the child ability to concentrate. He would be having a lot of impulsive behaviors, hyperactive, and it will stay with them throughout their life. When it comes to learning difficulty, sometimes it is difficult. Sometimes you have children with learning difficulty alone, but in autism, the child may have learning difficulty as a result of his autism. The learning difficulty resources by themselves is just like a child cannot acquire the information or process the information or retain the information. These are all different, but they can be combined at a certain degree with different children. And we see that in the spectrum, because when you say spectrum, child can be with a different degree of combination or maybe 1 or 2 disorders in the same time. A lot of time children with autism become hyperactive. What we know about autism is the classical signs, which is the child have challenges with communication, social interaction, and a lot of them would have stereotype or non-stereotyped behaviors. Again, we need to identify them very early, because they are able to be educated with certain specific techniques. We do behavioral intervention, which is ABA therapy. The other term is called applied behavioral analysis, where we analyze the behavior, come to the root causes, and come up with intervention plans and implement them. The child needs to learn visually with tactile. Language is not enough to teach the child. Again, we have seen a lot of improvement with many children, especially the young ones. We as a center, we prepare the child for the school. We teach them the skills they need to succeed in the school. In our programs, the children in the beginning, they start with learning help self skills, compliance skills, social skills, communication. And as they grow, we prepare them for school by giving them more skills on cognitive skills, executive functioning, how to get organized, how to follow orders, prioritize things. And again, which is very important and is lacking with them, is the social interaction. When they go into the school, we want to support them with academics. So we try to help them to understand language, to understand the problem solving, math, physics, so they can have a successful journey during school time and hopefully able to make it to college and university. There are a lot of cases where people have overcome their challenges. We know a lot of people down there are working, married, having a successful life. So we know that there is
something
it's not like mental retardation where the person have to be dependent all the time on some help, though we might see some combination in severe cases, yes.
Dr. Hibah, what are the signs that the parents should look for in their child to know if they have autism or not, and what they should do to treat that, or who they should call?
Some of the classical signs that the parents may notice is lack of eye contact. So a child can be like 6 months old and you call him and he doesn't turn his head to you or he doesn't look back.
Okay.
If the mother is breastfeeding, she will try to do eye contact. Normal babies look at their mother, but a child who's born with autism may not give that eye contact. So it's one of the very early signs that a parent can notice, and it might raise their awareness. The second, the very little ones, usually they don't talk, so the parents cannot really know, but they can notice something like the child get irritated very easily. They don't respond to their name. You talk to them, they are not there. They don't. You feel like they are distant. They're not with you. When they grow older, like by the age of 1 year old, the child should be able to say mama, baba, bubble. But a child with autism won't say mama or baba. They won't talk. These are some of the early signs. So if a mother, up to sometimes 1 year and a half, the parents would notice that the child is not acting, playing alone, playing wrongly with the toys. He's maybe around the children, but not playing with the children. Instead of playing with a car, like going on the floor like he sees normal cars, he will be spinning the wheels because they are more interested in repeatable motions. They might be spinning around themselves, going around and around and around. Repeated movement is something that the children like to do, so they switch on and off, on and off, on and off. So parents notice some of these behaviors should raise their awareness. It doesn't mean that the child have autism, but it should be enough indications for them to go and seek psychological advice. Because if the child have nothing, then it's fine. But if they have something, then it's better to do it at that time, because it's more effective and it's less costly and it will give them better results when they start
when they
early with a child.
Younger.
The other part of your question is what should the parent do? They have to go to specialist pediatricians or a child doctor who is specialized in developmental disorders, or they can go to a psychologist, or sometimes be referred to their social worker or whoever who is having a knowledge, enough experience with children to transfer them or to refer them to the right available service in their area. Again, there are some people who live in remote areas. There are no services. So it takes them time to reach to the right people to look at the child and diagnose him. What we try to do, what we call is developmental screening. This is a good training for school teachers, nursery teachers, because they are the ones who work with very young children. And it's very important for them to realize what is the normal developmental milestone of a child. So when they receive a child who's 2 years old and doesn't talk, it should raise awareness. Or when they see a child who's 1.5 years old and he doesn't have any words, because these are some warning signs. So it's very important that the whole community should be aware about the normal developmental signs. But a lot of mothers who are not really young mothers or not really in a place where they have access to this information or language barrier, they don't know these informations. So it's very important that primary health centers, the nurses who check the child regularly to give him the vaccine, they have to look for signs And this is something that we want to raise awareness towards, is that it's not only the mother's responsibility, but again, it's the doctors who's following up with the child on their vaccines, the nurse who sees the child, the teacher in the nursery. They are all responsible to detect children who have risks and they might be missed. And we've seen people who have been missed for a very long time, and then by the time the parents seek help, the child is 6 or 7, it's way beyond school age. It's more difficult.
Can the person who has autism be successful in life and in the community?
To answer this question, we have to look at, yes, it is possible. There are successful people who are married, who have jobs, and who are able to function in the society. We cannot say that autism is curable because it's not a disease that you can cure. It is a developmental disorder that makes some limitation for the person as a child. But if he received the right services and the right support, and sometimes they need the support for a long period of time, they will need support as a children, as young adults, and this, with the right support, they will learn how to function in the society. They will learn how to understand social cues, how to earn a living, how to master something that they can be successful at, based on what they like, based on what they are good at. Yes, there is cases who have been successful. We never can say at a young age that this child will be successful and this one cannot, because they change. It's a spectrum. People move in this